Hello, my name is Yesenia, and today we're going to be discussing the implementation of mobile health clinics for underserved populations. A well-known issue that has been noted in the community of Elko, Nevada is the lack of resources that we have to offer underserved populations. Underserved populations are groups of individuals who do not typically have access to medical care. These individuals do not often speak English, are geographically isolated, disabled, elderly, or socioeconomically disadvantaged. Reaching these individuals has presented quite a challenge for healthcare professionals because we do not have the appropriate resources that we need to that because we do not have the appropriate resources that we need to appropriately care for this population. With many disparities affecting the health of underserved populations, it is imperative that policymakers and healthcare professionals develop an intervention that can be used to manage chronic diseases, promote preventative health, and improve health outcomes for this population. In order to appropriately care for this population, a change in how care is delivered must be made. My proposal for this community is to implement a mobile health clinic. Mobile health clinics play an important role in healthcare industry because they provide care to underserved populations. Mobile health clinics help communities by overcoming common barriers of accessing healthcare such as time, geography, and trust, and have also demonstrated improvements in health outcomes and reductions in costs. Mobile health clinics are great resources for communities because they provide quality care at a lower cost than most facilities. By focusing our attention on the community, I believe that mobile health clinics can improve access to care by serving as a vital link between the community and clinical facilities. Mobile health clinics are important resources that can be utilized all around the community because they have many services that can be offered to individuals at a low cost or can even be offered to individuals for no cost, depending on the situation at hand. Services that can be offered at mobile health clinics may vary, but they often include services such as preventative health screenings, chronic disease management, preventative healthcare services, immunizations, etc. These services are often provided by a combination of staff members that often include physicians, nurses, community healthcare workers, and other healthcare professionals. In order for this change to occur, there are a few things that need to be taken into consideration. For one, we need to get all members of the community and organizational leaders to see that this intervention is needed for the community of Elko, Nevada. Secondly, we must obtain appropriate funding for the mobile health clinic. And last but not least, we need to find individuals who are passionate about providing care to those who are less fortunate than us. For this intervention, I do not believe that a stakeholder's position will be greatly impacted because the goal of this intervention is to promote and improve health outcomes in underserved populations. However, I do believe that stakeholders should be aware that challenges to operating a functional mobile health clinic can occur over the first few years of starting a new clinic, which will be discussed later on in the PowerPoint. As for some individuals that will need to be As for some individuals that will be needed to implement this intervention is the support from the community, nurses, physicians, and other healthcare professionals to run the clinic. Also, collaboration with other clinics and hospitals will be needed to successfully operate a functional mobile health clinic. As for a way that I plan on communicating this change to the organizational and community leaders, is by holding a town hall meeting with all members of the organization to discuss the issue at hand. During this meeting, we will discuss the lack of care that this population receives, along with my solution of implementing a mobile health clinic. Since the majority of mobile health clinics are funded by philanthropy or state/federal funds, I will also be asking the community to take into consideration funding this program so we can provide care to those who are less fortunate than us. As for some challenges and risks that can occur with the implementation of a mobile health clinic are issues with financing. As stated before, mobile health clinics are often funded by philanthropy or state/federal funds. As for another issue that I can foresee happening with implementation of a mobile health clinic is a lack of services that are being offered to individuals due to the lack of advertisement or the location of the clinic being in a spot that is not easily accessible to those who need treatment. These are the references that I use for my PowerPoint. In here I have references that I put in the PowerPoint, as well as references for pictures that I used in the PowerPoint. And that is all that I have. Thank you.